afternoon, everyone, and welcome to today's Public Health Ontario Rounds presentation on Nail Salon Workers Project at Parkdale, Queen West CHC, an example of community-driven public health. My name is Ginny Kim. I'm a physician lead at Public Health Ontario, and I have the pleasure of moderating today's session. And we are meeting virtually today, but I do want to acknowledge the land on which we are gathered. For thousands of years, this land has been the traditional territories of the nations that include the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. The Mississaugas of the Credit are the treaty signatories and stewards of the land on which we are meeting today, or most of us who are here in the GTA. Toronto is on the territory of the Dish-with-One-Spoon Wampum Belt Covenant, an agreement that meant that the Anishinaabe, the Haudenosaunee, and other allied nations in this area would share and care for the land. Where I am in Toronto, I acknowledge that this territory is governed by Treaty 13, also known as the Toronto Purchase. Today, this place is still the home to many First Nations, Inuit, and Métis people from across Turtle Island, and I'm grateful to have the opportunity to gather and work on this land. And now, before we begin, I will mention a few housekeeping items. Firstly, I want to state that as the moderator of this session, I have no conflict of interest related to this presentation to declare. The chat pod has been disabled to limit any distractions during the presentation. Please instead use a Q&A pod if you have questions during the session, which you'll be able to access from the bottom of the Zoom screen. A discussion and question period will follow the presentation. And if at any point during this session you experience any technical issues, or if you require CME credits, please email capacitybuilding, one word, at oahpp.ca. So with that, it is now my pleasure to present our speakers for today's event: Kate Ahrens, Jackie Liang, Neil Magdalas, and Victoria Arundale. Kate is a health promoter at Parkdale Queen West Community Health Centre. Jackie Liang is a community health worker at Parkdale Queen West Community Health Centre. Neil is a volunteer with the Nail Salon Workers Project at Parkdale Queen West CHC and a recent York University graduate. And Victoria is an assistant professor at the Dalla Lana School of Public Health at Toronto, at the University of Toronto. So it's my pleasure now to hand it over to our speakers to start today's presentation.
Thank you very much, Jinhee, and thank you to the organizers for inviting us to share this work. We're really excited to be here together to tell you a little bit about all of the things, or most of the things we've been working on for several years now. So as required, we've developed some learning objectives. So what we're hoping is that by the end of our presentation, those of you in the audience will be able to recall some of the hazards and the health risks that nail technicians face while they're at work, that you will be able to discuss the challenges faced when working to reduce the impacts of hazards or reduce health risks among nail salon owners and technicians, that you'll be able to describe a bit about the range and the scope of the work that's been supported by this Nail Salon Workers Project based at Parkdale West CHC. Parkdale Queen West CHC, sorry, and ultimately identify some examples where community health centers can support public and occupational health through their programs. Jinhee introduced us all in terms of our employment, so I've included this slide here as well, and in terms of disclosures, just considering Jackie's experience as a nail technician. She's now a community health worker, but she has years of experience working as a nail technician in salons. And myself, in terms of disclosures relevant to this talk, I am a member of the WSIB's Scientific Advisory Table on Occupational Disease, which is sort of connected to some of the things that I'm going to talk about today, as well as research funding that I hold. But we're going to do this as a team. There are 4 of us here, but many groups and many people have been involved in this work. And so we're a small portion of that team, and we're really pleased to be here to talk a little bit about what we've done. So folks may remember that about a decade ago now, there was a bit of an expose in the New York Times, and it was done as a feature over several weeks that really pulled back the curtain on the working conditions in nail salons in New York City. And obviously that's a bit different than Toronto, but it was really the first time that this had gotten attention in the mainstream media, and it identified issues around chemicals, but also around employment standards and abuses, quite frankly, of workers in the salons in New York City. And over the coming years, there was a lot more interest across North America, so in several US cities, but also here in Toronto and in the prairies as well, where people started to ask questions about what was happening in nail salons and what were the working conditions and working environment like for the technicians who were in these salons. So obviously nail services can happen in many different places. So they can happen in hair salons, they can happen in cosmetology environments, they can happen in very high-end salons. The work that we're going to talk about today is going to focus largely on the discount nail salons in an urban area in downtown Toronto. And so in these discount salons where the price point is maybe a little bit lower, the majority of the tasks or the services that are being provided are these manicures and pedicures and artificial nails, but it includes a lot of different tasks. And so for those of you that frequent nail salons, you'll be familiar, but I realize that's not everybody's cup of tea, but it can include cuticle cutting. So there is cutting of the skin or the dead skin on the nails. There's filing. There's a lot of contact with personal care products around massage or moisturizers. They're applying polishes that can be traditional polishes or the newer shellac polishes that include acrylates, which is a sensitizing chemical. They can be applying artificial nails that take many forms and many formulations. And as I suspect people are aware of from an infection prevention and control perspective, there's also a lot of cleaning and disinfecting of the surfaces and of the tools that are being used to provide these services. The workers in these spaces, the nail technicians who are providing the services, they are largely female. They're often new to Canada. They're often racialized. And English is often not their first language. Unlike other trades or other beauty professions like hairdressing, there's no apprenticeship for nail technicians. There's no required licensing for them at an individual level. So we don't have a list. We don't know the numbers. We don't know who they are. We also know that they're often precariously employed and that there's concerns around misclassification, meaning that they may be being paid as contractors rather than employees, and there's impacts for that. And it's also an interesting environment in terms of this intersection between concern for consumer health or client health, people coming to get the services, and the workers. So there's an intersection here between different groups of people and different rules and regulations. I'm not going to talk too much about this today, but on the right, I'm just showing you at the top the variety of hazards that exist in nail salons, which I've alluded to a little bit, but chemicals, infectious diseases, artificial UV used to cure some of these products, but also ergonomic hazards and sort of that work stress in terms of rushing and client expectations. And in the literature, there's pretty good evidence that nail salon technicians are at increased risk of things like skin disease and respiratory health effects. There's some suggestion that there may also be links to adverse reproductive outcomes and potentially some cancers as well, but that's less conclusive for those last two.
Hi, everyone. So these same issues are affecting nail technicians and employers all over the place with various, the politics are slightly different and the regulations can be different, but in general, the same issues are being faced throughout the US and throughout Canada. So we've come to understand that community organizing is quite common. Here are some of the examples in Boston, Michigan, across California, and in New York. And all these different collaboratives have emerged in response to different things and for different reasons, but we have connected with these organizations to see the parallels and how we can work together. So in Toronto, we have the Toronto Healthy Nail Salon Coalition, 2 health promoters working at Parkdale Queen West Community Health Center back in 2013 received a grant from Women's College Hospital to do some community-based research and find out how do nail technicians understand the risks that they face at work and what are some of the barriers to mitigating those risks. And one of the outcomes of that project was a roundtable discussion where a variety of organizations and individuals and nail technicians came together to talk about common ground and the issues that they may already be working on or wanting to tackle. And there was a desire to form a network, or now a coalition of allied agencies and people looking to improve work and health conditions in, we'll just go back one more slide, work and health conditions in nail salons. So fast forward 10 years, we're now a multi-stakeholder group. We've done some strategic planning. We have a shared goal to improve health and working conditions, and we've supported a number of projects and different groups throughout the years. So here's just a sample of some of the things we've done as a coalition, building and evaluating resources for peer-led workshops in salons, delivering workplace health and safety education to nail salon workers in nail salons, assessing occupational exposure in Ontario nail salons, surveys of both nail technicians and consumers, supporting the development of a nail technicians network, supporting the nail technician community during COVID, and you'll hear more about that later, and a number of arts-based worker engagement projects. We'll also talk more about that soon. So throughout the years and with the variety of organizations around the table, we've identified opportunities for improvement. So I'm going to just read through these because it ties back to what Victoria said in terms of the layers of barriers that nail technicians and employers are facing for improvement. So at the national level, there's federal and provincial harmonization opportunities in alignment with international best practices. There can be updates to WMIS and the chemicals management plan, including improved enforcement. At the provincial level, increased enforcement of occupational health and safety in personal service settings, mandatory WSIB registration for personal service settings, and improve the clinical pathways for early detection and screening. At the municipal level, we can have greater inclusion of workers and workplaces in public health activities. At the community level, we can develop voluntary certification programs, as we've seen elsewhere, and explore covenants and social dialogue approaches. And at the individual level, we can be empowering workers and customers to ask for safer products and support nail salon owners in making safer choices, both in terms of how they carry out the business in the salons, but also what products are available. So zeroing in on the Parkdale Queen West Community Health Center Nail Salon Workers Project, over the past 10 years, we've zeroed in. The program aims to be increasing occupational health and safety knowledge and behaviors, increasing public awareness of the issues facing these nail technicians and owners, increasing regulatory protections, increasing structural supports. And then we do this in a number of ways. So again, looking back to that 2013 research grant to understand the barriers, in the last 10 years, we've grown and are now running training and capacity building opportunities in the community, participating in research and supporting research, like with Victoria at the Dalla Lana School of Public Health. We're working on policy change and advocacy with a number of partners, always looking for partnership building, because you can imagine with these many, many layers and issues, we can't do it all alone, and program development. So that's looking internally to always responding to community need. How are we aligning what we're doing based on what the community is telling us are their priorities? How are we measuring what we do? How do we look for impact? And then how do we communicate that back, both to the community and to policy level and partners? And community engagement approach really underpins all of this work. So as I just mentioned, community engagement is really at the heart of what we do at Parkdale Queen West through the Nail Salon Workers Project. So that can look like a number of different things. Outreach, we always have an outreach team. That's a group of people either from within the nail salon sector or people that have close ties to the nail salon sector and speak the language of the dominant groups within that sector. So right now we have people hired from within the Vietnamese community, the Chinese Mandarin speaking community, and the Korean speaking community. And you can see on this outreach map, this is just a snapshot of the 2023 and 24 outreach activities, but all of those pins identify a salon or a location where we've met with nail technicians and owners and talked about the work that we're doing and try to listen to what the needs and issues are. We've seen just in the past year and a bit, 258 distinct salons and done 373 outreach visits. We can talk more about that later as well. Other than outreach, we also carry out workshops, so that can be in salons, in person at specific locations, and online. We've developed a number of sector-specific resources, so taking health and safety information that's out there in the world and making it really tailored and accessible for communities that we're working with. We've carried out a number of arts-based projects, which Jackie and Neil are going to talk about next. And we carry out social events because we found that not everybody wants to show up to a health and safety event, but if we pair it with something that meets the need of the community, then we can also bring in learning opportunities and ways to raise awareness. As I mentioned before, research, and we engage community in research. We put out opportunities to have members of the community participate in that research and become take on different leadership roles within those research activities. And newer for us is taking what we do and putting it into the social media realm. And Neil's going to talk more about that. So I mentioned resources. Here on the right, you can see some examples developed by us and by the Center for Research Expertise in Occupational Disease. We have amazing illustrators who've helped us with the imagery, and you can see we've tackled issues like ergonomics, healthy skin, reducing risks to reproductive health, and reducing risk to respiratory health. That's not all of them. You can see other resources we've created at this website link here. And we're in the middle of a website redesign. So if you check back in a couple of months, it may look different, but yes, all the resources are there in multiple languages. So everything that we publish, we fund the translation into simplified Chinese, Vietnamese, and Korean as well. We make the materials online accessible and bring hard copies right to salons. The first topic we took on was skin protection and tested the model where we create a resource and some demonstration materials and then go out into salons and do little mini demos with technicians at their workplace, providing honorariums for owners and technicians for their time because we take up space in the salon and prevent them from seeing clients. So we did a pre-survey, a post-survey, and then looked at evaluating what changes happened 6 months after those workshops. And what we found is there's an increased awareness of risks, increased knowledge and use of protective measures, and better understanding of health impacts. So we took that model and we carried it out with other health issue topics over the last 10 years. Over to you, Victoria.
Thanks, Kate. Also early on, with support from the Ministry of Labor, Immigration, Training, and Skills Development, we undertook a workplace exposure study, and this sort of falls into that research bucket. It was led by folks at the Occupational Cancer Research Center, where I was at the time, and also University of Toronto. And we were able to recruit 21 salons and 55 workers, and we did use occupational hygiene assessment approaches to look at volatile organic compounds, including things like formaldehyde and acrylates in the air in these salons. We also looked at acrylates on the surfaces. we were particularly interested in ergonomics, which I'll talk about a bit in a moment, but also the job demands and the job control that the nail technicians had over their work tasks to get a better assessment of their job stress. And what we're showing at the bottom of this slide is the prevalence of pain in different parts of the body. And you can see that it's quite common among the nail technicians. So more than half of nail technicians who participated reporting neck or shoulder pain, the next most common being back pain and hand wrist pain. And what I'll just highlight is that these are workers who were still at work. So workers who may have left the job would be missed here. So this may in fact be a bit of an underestimate. And among these workers who were having these symptoms, more than 2/3 of those with neck, shoulder, back, and hand pain reported that it was worse while they were at work. So that is suggestive of these problems being work-related problems. And so this fed into some of the work that Kate's talking about, where we worked on developing the ergonomic resources and things like that, to try and address some of the concerns and the problems that workers were having. And I'm going to pass to Neil now to talk about more recent engagement efforts.
Thank you, Victoria. So about a year and a half ago, we created our first video, which has now surpassed 250 views and counting. So this engagement hopefully translates into more nail technicians learning about the project and adapting the best practices shown in the video. We've also added 3 more health and safety videos since then. And recently, we posted another video called a video about the project called Flavors of Life, and which Jackie will tell you more about in a moment. While social media has increased the project's exposure, we have several unknowns, including viewer engagement, attention span, time consumption, misleading information, and language barriers. Regarding viewer engagement and attention span, we are unsure if our content is reaching the right audience or if viewers are simply scrolling past our videos. Additionally, creating videos, while enjoyable, is incredibly time-consuming. It involves countless hours of editing and choosing the best words and visuals to convey our message effectively. Another challenge is the potential for misleading information. Some viewers might misinterpret our content and think that visiting nail salons is harmful for them, which in reality, we aim to help nail technicians prevent negative health effects caused by the chemicals they work with. Lastly, language barriers present a significant obstacle. Many nail technicians have English as their second language, which may prevent them from fully understanding the video's content. And with that said, we aim to mitigate this by building visual cues into the video. Despite these challenges, we are committed to using social media to promote health and safety practice and support nail technicians in their work. We know this group of workers use social media, and through this process, we're building our team's capacity to respond in this way. We have gotten better at translating our materials into short clips, and we have lots of content to work with, and also have heard positive feedback from the viewers. We can't speak to what the videos are having yet. We can't speak to what impact the videos are having yet, but given the role of social media more broadly, this is something we're going to keep working at. And I'll be passing it to Jackie.
As Kay mentioned, one of the ways that we engage with the community is through art-based project. Most recently, we finished the Flavor of Life, which provided the space for nail technicians to explore their experience through creating their own art piece, and the public and other nail technicians to have a glimpse of their life success, challenges, hopes, and dreams. We have also done a photo voice and animation project and see how well art can engage nail technicians and bring their stories to a larger audience. We are starting to make more videos to help the project to get more attention and attract more nail technicians. And we made an invitation video for the art exhibit. We also made documentary videos to record the process of this art project. and took pictures during the training session, and then made a 2-minute video and played at our exhibition. This not only encourages project participants and nail technicians, but also helps people who attend our exhibition to know more and better about this art project. The third video of this project was a mini exhibition video that we made during the event to promote this exhibition and give the people a little sense of what the exhibition looks like. Now we are working on a website to record the artworks that they made, which allow people and other nail technicians to have a chance to know more about this project. Next slide, please. During the pandemic, we established a series of action and support nail technicians. We made wellness calls to give them emotion support and update them with some new information about the new public health guidelines, CRB, and the rent subsidy, and help them to apply if they are qualified for that. We organize online health workshops in different languages, like the new public health guidelines, cleaning and disinfecting webinar, safe reopening workshop, and a follow-up Q&A session. Outreach into the nail salons during the reopening. We brought COVID safety posters to the nail salons, chatted with them, and give them support directly. We also create an anti-Asian racism to respond to racism at work, develop a cleaning and disinfecting booklet for nail technicians, and a mask and ventilation information sheet. After the pandemic, the nail sector changed a lot, and nail technicians' needs changed as well. Continue the nail technician is even harder than before. We had to find new ways to engage them, and we focus on the in-person workshops to build a rapport with nail technicians and strengthen our base. We started to do the mini workshops, like do 5 to 10 minutes based on our 4 modules, occupational health and safety in the nail salons. We also made shorter health videos that follow the mini workshops topic. The short video can help this health information spread widely because it's short, won't take much time for nail technicians when we show them. Also, nail technicians can watch them again by themselves. We are still focusing on delivering the mini workshops about occupational health, like doing some demos in the nail salons and teaching them how to protect themselves, as well as using social media to promote it and give all the booklets, brochure, and other materials related to them. I just stop here. I pass it back to Victoria.
Thanks. I think, as Jackie noted, there was lots of changes in nail salons sort of during COVID and sort of post-COVID. And one of the things that really got us thinking more about in our work was thinking beyond the workers. You know, we've said earlier that we really started with a focus on nail technicians, but the owners or the employers and customers are also in these spaces, and there's sort of like 3 pillars, 3 groups of people that could potentially be impacting what products are used or what practices are being done, what prevention measures are being taken, and things like that. And so certainly we're thinking more about these other groups and expanding our work to include and try and engage more fully and meaningfully with these other groups. And to that end, last year in 2023, Dr. Ann Tran, who was a postdoc, undertook an online survey of nail salon customers to get a sense of how their nail salon attendance or experience may have changed as you know, following COVID, as well as get their perspectives on things like health and safety in nail salons. And her results were very interesting in that there was quite varied patterns in attendance, but more than 3/4 of the customers who responded were going to the nail salon as often or more often than they did before the COVID-19 pandemic. So really highlighting for us that although this is variable, I want to highlight that that certainly this is not something that's going away. People are really enjoy and like the services that they receive in nail salons. And so this is sort of a continuing issue that we think is important. But we did have some other really interesting findings from Anne's work. You know, we found that customers are generally very satisfied with their perception of air quality and cleanliness in salons. And something that's been of real interest to the coalition as a whole has been sort of chemicals and toxics and the marketing of some products as being lower or free of particularly hazardous chemicals. And in the customer survey that Anne did, the awareness of these products was actually very low. About 1 in 5 customers even knew that these existed. And so, and what I didn't put on the slide, but that they also tend to go to the same salon over and over again, and even to see the same nail technician over and over again. And one of Anne's conclusions is that this really offers a bit of an opportunity perhaps to increase awareness and do some customer education around what choices we could be making around products and practices in salons. So we're excited, I think, to broaden some of the work and, you know, towards hopefully making a bigger impact. And I'm going to pass to Kate now.
So what's next for all of this work? We're going to continue the SSHRC-funded Race, Gender, and Diversity project. We're about halfway through that project now. That's collaboration between Parkdale Queen West Community Health Center and the team that you see here, and Victoria Arundel at the Dalalana School of Public Health. We have a number of private foundation grants that we've had in the past and continue to apply for into the future. And one of the things we're looking to do is find some institutionalized funding where we identify the ways in which we're carrying out public health and Ministry of Labor activities and try and find funding to fill those gaps for the work that we're doing. We're working to include nail technician, customer, and owner perspectives, which we've done in the past, but want to better understand and use customer and owner voices to support change. We are going to design a campaign to increase knowledge and awareness and stimulate action in these ways. We're continuing to expand the ways that we can support the community. So for example, being in the community health center over the next year, we're going to be looking to connect workers and owners with their preventative cancer screening opportunities, make sure people know how they're eligible for those things, and then create the pathway for people to say yes to those screening options that they have here in Canada. We want to identify opportunities to improve policies impacting workers, which again, we've started to do, but where are the opportunities in this moment, and really zero in on that. And want to continue to expand the network of workers and supports for this work. There's so many layers and so much work to do that we're always looking for new partners. We want to expand the reach across Ontario. We've worked with some organizations in Manitoba who's doing similar work, so we're open to places across Canada and how can we share what we've learned, resources that we've developed, and how can they be adapted in new places. Next slide, please. So community health centers and public health. We really want to underscore that CHCs have strong community relationships. We're experienced in developing and maintaining these relationships. We have lots of experience in meeting people where they're at and an ability to respond to gaps. And we've seen this be successful in the harm reduction and dental programs in the CHC. And similarly here with this group of workers who have been marginalized, we have an opportunity and have shown that we can connect with workers, build trusted relationships, and be an avenue for the health and safety information that they're entitled to and need to be meeting in terms of their requirements as well. We know it's difficult to reach new groups. It's not unique to this group of workers, but the way that we've been carrying out this community-based work shows that that building of relationships and trust is the way into new information and improved practice. and also wanting to highlight here that there's a willingness and a desire to improve within the community. So whenever we meet, I mean, there's the exceptional cases where people don't want to hear from the outreach team and don't welcome them into the salons. We find usually that's just a matter of misunderstanding, and it takes time and repeated visits to explain that, no, this isn't about selling something. No, this isn't about checking in on or getting people in trouble. We really want to lift up and support people in the ways that they deserve to be supported. And when we have those conversations, the desire to make things healthier and better for workers and employers is there. And always asking for how else can we do this? What else do you have to teach us about, or what other opportunities can we be connected to? So main messages for everyone today, knowing that lots of people come from different workplaces, will carry this out in different ways, but wanted to highlight a few things. So together we're working to improve health and working conditions for nail technicians. And really, we say nail technicians because that's the focus, but we bring employers and nail technicians to the table because a lot of these improvements are better for everybody. Within the CHC model, we're able to see and understand that work is an important determinant of health, and we really want to highlight that today. And that CHC's community health centers can support public and occupational health through our programming and the approach. So some reflections to take away as a public health practitioner. Thinking about including community-based organizations in your practice. Advocating for leveraging existing community-based organizations and relationships to enhance public health outcomes. So in this case, finding out who has the relationship with that community. How can we be in touch with that organization or that group of people and build on existing trust and relationships? And last but not least, consider public health core competencies. For example, partnerships, collaboration, and advocacy. And we think that this Nail Salon Workers Project is really an example of how those things help to increase public health within the community. Here you have a number of logos showing the various support that we've had over the years, partners and funders. It's not an exhaustive list, but those are some of the main ones. Thank you, everyone, for taking your lunch hour to be with us, and we'll open it up to question and answer.
Thank you, everyone. We will now, as Kate mentioned, move on to the Q&A segment of this event to address some of the questions from the audience. And I see a couple of questions in the Q&A pod, but I'll invite members of the audience to type in your questions. Okay, and I'm wondering if, as the moderator, if I can ask the first one. Really curious to hear, Victoria, you mentioned some of the measurements you took in some of the salons. You mentioned formaldehyde, some of the VOCs. I'm really curious to know if you're able to provide just a high level sort of lessons learned, or some key findings from that work.
Yeah, thanks, Jinhee. So at a very high level, so we definitely detected a lot of volatile organics, as folks I think will appreciate that you can often smell things like the acetone when you're in or walking past nail salons. I think some of the more interesting results from that were that we found formaldehyde. We detected formaldehyde in all of the salons that we were able to sample in. And so formaldehyde is a carcinogen. It's an upper respiratory carcinogen. It was at quite low levels relatively to other occupational settings, but it was certainly there. And I think we were surprised by that. And that's sort of still working its way through publication with one of the students on the project. The other place was the acrylates, and acrylates are sensitizing chemicals. And in the clinical side, you see allergic reactions to acrylates among customers, but also among technicians who may be providing services. And We didn't detect a lot of acrylates on the hands of the workers, so we looked at what was on their hands and what was on surfaces. And the good news is that we didn't detect a lot of acrylates on worker hands or on surfaces, but it's certainly in the product. So we did do a little bit of bulk testing, and we were certainly able to find a lot of acrylates in the product. So that was a bit of a good news story about the practices that were in place when handling those chemicals. So.
Thanks very much. Yeah, looking forward to seeing more details. Hopefully it's coming soon. Okay, I have some more questions, but I think there are several that have been asked by members of the audience, so I'll move to the Q&A pod. Someone has commented that, that they really liked the graphics that were part of the presentations that you shared, especially the resources for the nail salon workers. How do you, could you talk about how the process of adapting the education materials for low literacy nail salon workers?
Sure, I can answer that. And Jackie, jump in if you'd like to add anything. So we're very grateful. Someone by the name of Bjorn Arthurs made those beautiful illustrations for us. We worked with Bjorn a number of times, and they're very generous about letting us use those illustrations for whatever we need. So it's really become kind of the style of the imagery that we use. So thanks for that compliment. And in terms of how do we make education materials more accessible, try and make things visual as much as possible, or have the content and include a visual, which probably is not new for anyone here. But we test the materials is a really important part. So we have a group of outreach workers that are in the community, hired from within the community. And when we're drafting those materials, we always bring it back to that group of outreach workers, sometimes nail technicians beyond the outreach team as well. But we want to compensate people for their time, and those outreach workers are in a paid role and use those paid hours to review materials, ask questions, let us know when something isn't clear. And we do that again once they're translated as well, so people can be doing that in their first language. So that feedback loop, doing it again and again, is time consuming and expensive, and it's really key, because you know what we're doing is trying to make things accessible, so we can't guess at that.
Thanks very much. What a great partnership that you're describing with the artists. That's really wonderful.
Sorry, Jinhee, can I just add something? The other piece that I really want to underscore, the model that we've tried to create here and test, is that anytime we're delivering that hard copy material, ideally it's coming with some one-on-one education and training as well. And that's a huge piece about how to make the materials accessible, is that we're not just dropping it off, we're not just leaving it on a table and hoping people pick it up, but walking people through that content, answering questions, applying it to the salon setting, and then we leave it behind. That's the best case scenario.
Right. How you deliver it is as important as the material itself. Okay, there's a question about technicians with precarious immigration status. Is that something that you see, and perhaps if how you've sort of provided support for those individuals?
I think I can answer this. Is yes, is many new technicians, as I know, is they are non-status, and I can give you example is how we have them during the pandemic, and have a vaccine. Is they can get a service. Is we is build a connection with our center to come here to get the vaccine, and also it's like the legal, is the aspects issues, and we have the partners as we do the referral and to help us.
Can I add to that a little? Yeah, I think that's really important, Jackie. What you're saying is that is one of the benefits of the partnership with the CHC, is that ability to access that low barrier healthcare for folks that maybe can't access through other avenues or can't easily access. I think the other thing I would just be transparent about is when we started the work a decade ago, we really were quite explicit. Like we did try and avoid the employment standard immigration issue that we started from. As I hope I was clear, we started from like the worker and the worker health and the working conditions piece, because we didn't want to make people uncomfortable or put people in situations where they were going to feel unsafe engaging with the activities and with the training and the education. So initially it was a very deliberate act to sort of leave all of that off the table. And over time, I think, Jackie, it's come from the community, right? So then the community brought these concerns to the table, and then you and the Nail Technicians Network and Parkdale Queen West have worked to find pathways and other avenues to address some of them. But it really, we purposely sort of left it alone initially and waited for it to come forward and be brought to us. Yeah.
And truthfully, it continues to be that way as well. I mean, there's a lot of interest in the numbers, how many people are undocumented, and there's been a real concerted decision to not ask, even though we'd like to know those numbers. It possibly jeopardizes the relationships that we have in the community.
Thanks. Yeah, and related to that, there's a question about public health inspections while project staff are on site, and I think that touches a little bit too on this tension, right, between enforcement or the checking, versus the like a health promoting, engaging environment. Was there any coordination that was necessary, or maybe you haven't run into that issue?
There's been confusion for sure, and the outreach team has to continuously reiterate who we are, what we're trying to do, and that doesn't always work. So repeating the message. We've also tried to be clear that we're happy to make that bridge so that people can ask questions to Toronto Public Health. So during COVID-19, for example, we ran the closures, I'll be more specific, the closures during the pandemic. We hosted online workshops so that people, Jackie was saying about understanding how to safely reopen, what are the new rules, what do people need to do? And we actually had Cecilia Alterman from Toronto Public Health come and answer questions and try and be that bridge about, people aren't trying to get others in trouble here, but it's good to ask clarifying questions. And so be really clear about what the requirements are. If you're unsure about what you're using is safe or not, ask those questions and have them answered. Jackie, have you ever run into public health inspectors while you're doing outreach?
So far is I never met, but it's I heard it's salon owners contact me and said it's just maybe Mr. Labor or Public Health come and give me these documents. I don't know what they're going to say. Ask me to explain it. Yeah, that happens several times.
I think that's an interesting piece, Jackie, because the folks that are in the public health world will there was an update several years ago around the guidance for personal service sector generally. And I think that the outreach team did a lot of translation around the implementation, like for the nail salons particularly, but your group was a really big resource for the owners around understanding what they needed to do, because it was in some cases relatively new. I think it hadn't, even though it was there before, it hadn't sort of penetrated, but the update really drew attention to some of those requirements. And so there was a lot of communication about that when it came out in sort of a more informal way.
Great. There's also a comment. I really like the idea of providing more public knowledge on the hazards. Businesses will put profits over people, but customer choice will impact business offerings. And I think this refers a little bit, I think it aligns with some of the findings that you shared, the unpublished findings about, what people know about the exposures when you go into these salons. So there's actually, a question as well about what are the less harmful substitutes to chemicals that are commonly used in nail salons? Are there, and I'll just maybe add on, if there are certain things that, key takeaways for public members of the public, right, to sort of demand or request these types of products.
I can try, and then others can chime in. So yeah, I agree with the comment, and I think that's partly why we started to explore talking to customers and clients more. One of the challenges, and people may have picked up that we put safer in quotation marks on our slide. There is some evidence in the literature, but also from the California EPA, that's done some bulk testing of products that make claims about not having chemicals like benzene or toluene or formaldehyde, or to be safer than other alternatives. And unfortunately, they're often not true. So there has been, there's a labeling challenge, which ties into some of those federal or more, higher level concerns that the group has identified. So there are substitutes. I think we don't really understand if they're truly safer or not. And certainly from the nail technician and customer perspective, I think there's also concerns around the quality on some of those products. And sort of you can imagine if you go to get your nails done, you want it to be sort of last, right? You don't want it to peel or to crack and things. And so there's a question around, is it actually safer? Does it have less chemicals or less harmful chemicals? And then how does it perform? And so I think there's still a lot unknown there. We've certainly, just in that vein, I think, been more focused on reducing the exposure. So practices around, it may seem simple, but, having garbage cans with lids or putting caps back on bottles, like not leaving things open in between tasks, but also things like ventilation and how you can improve, perhaps it is just dilution, but getting fresh air in and things like that, rather than focusing on the products, because I don't think we feel confident in making recommendations there.
I'll just add, so during, again, safe reopening guidelines, there was a concern that we didn't know what cleaning products people would be using, what people are already using. And so we did a bit of a survey, and one of the longtime contributors to this project, Anne Rochon-Ford, did some research about what chemicals are out there, what do people understand about them, and then what are some safe alternatives that still meet the requirements of public health in terms of cleaning and disinfecting. So that's another way that, well, a few things, that there's just another layer of chemicals being piled on top of an already high chemical working environment. And when, there was maybe 1 or 2 stories about people getting COVID in a nail salon, and because they had been closed so much of the time, then people were afraid to be closed and afraid to get bad press. And there's a racism component there too, in terms of how the media was willing to frame certain types of salons, the ways certain types of businesses are run. All that to say, bleach is used a lot and it's not needed. And things like spraying bleach on things, because bleach is not a product that's used in all of the countries across the world necessarily. And here it's sold in big bottles. It's known to clean lots of things or disinfect lots of things. And so part of that material and workshops was about, you don't have to use bleach. You can use things like hydrogen peroxide, and here's the percentage that you need of rubbing alcohol, things like that. So there's the nail salon products, there's also cleaning products. And so while we can't necessarily replace nail products right now, we did do some work to try and do safer replacement of cleaning products.
Great, thank you. We're very close to the end, but there are still a few more questions, so just hoping to squeeze a couple more in. The one is, you presented data on ergonomic issues. Just overall, are there any data about disease outcomes related to this field of work? And also, Victoria, you mentioned ventilation or ventilation modifications. Are there some good ones, any aside from the fan use that you mentioned, and or any PPE, personal protective equipment?
It's a lot of questions. So I'll say just from the disease standpoint, there isn't a ton of work, and it sort of links into one of the challenges we identified, just that we don't have a list, right? We don't know who these workers are. So they're very difficult to follow, for example, in the administrative data that we would normally use to track a lot of disease in the province. It's also not a mandatory it's not an industry that has to mandatorily enroll with the Workers' Compensation Board here in Ontario, so they don't appear in our compensation statistics either. So some of the traditional data sources we have for looking at disease or work-related disease don't work for this group of workers. They're sort of hidden, they're missed in our data. In terms of PPE, we did some work early on. Kate talked about the skin resource around gloves. And certainly the recommendation is to use nitrile gloves, to double glove if you feel like you can maintain your dexterity, but also to be switching them often, and potentially using cotton liners underneath the nitrile gloves to improve comfort and reduce the sort of wet work exposure that goes along with that. I think the ventilation is a bigger question. There's certainly work being done by OCAL and others around using air cleaners to reduce particulates, but a lot of air cleaners don't reduce VOCs as well. So there, the ventilation becomes an issue of what are you targeting and what's going to work effectively for what you're targeting. And so I'll stop there because I can see the time.
Thank you. I really wanted to squeeze more in, but I know it was a very interesting presentation, and I'm sure I'm sorry. I apologize that we weren't able to get to all of them, but we do need to wrap up, and really want to thank Kate, Jackie, Neil, and Victoria, all of you for presenting. I also would like to thank everyone who joined for today's webinar. The members of the audience can expect to receive an anonymous PHO round survey for today's session. Please do try to complete this to help us improve our programming. And lastly, to access past PHO presentations and to view confirmed and upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentation. Thank you and have a wonderful day.